YouTube video script, I grilled Casey Means, Trump's unqualified pick for Surgeon General. All right, what's up everyone? Dr. William Lee here, and I have got to tell you, what you're about to watch is one of the most intense conversations I've had in recent memory. We're talking about someone who's quite literally been tapped to become the next Surgeon General of the United States, and the amount of controversy surrounding this nomination is absolutely staggering. I'm talking about Casey Means, and today we're diving deep into exactly what's going on with this appointment, why so many people in the medical community are completely losing their minds about it, and what it could actually mean for the future of healthcare in America. So if you care about your health, your fitness, your family's well-being, or just the overall direction of American medicine, you need to stick around for this one, because this is not your typical health and fitness video. This is a wake-up call. Now, before we jump in, I want to be really clear about something. I've been in the health and wellness space for decades, and I've seen a lot of trends come and go. I've seen a lot of misinformation spread, but what we're dealing with right now is something on a completely different level. When someone is nominated to be the Surgeon General of the United States, that person becomes the chief health educator for our entire nation. They're the guy or gal who stands at the podium when there's a public health crisis. They're the one advising the president on matters of national health. They're setting the tone for how Americans think about medicine, about wellness, about what doctors should be doing. So when we see a nomination that raises this many red flags among physicians, epidemiologists, and public health experts, we have to ask the hard questions. And that's exactly what we did. Casey Means has been described in various ways over the past few weeks. Some people call her a biohacker. Others call her a health entrepreneur. She's written about metabolic health. She started companies focused on continuous glucose monitoring and metabolic awareness. On the surface, some of that sounds pretty good, right? I mean, metabolic health is something I've talked about constantly on this channel. It's absolutely critical. The problem is when you dig deeper into her actual qualifications, her medical background, and the statements she's made, things start to get really messy really fast. Let me paint you a picture of what we're working with here. Casey Means is not a physician. She doesn't have an MD or a DO. She didn't go to medical school. She's not board certified in any medical specialty. She has an undergraduate degree, and while she's worked in healthcare adjacent fields, her background is fundamentally different from what you'd expect from a Surgeon General. Now, am I saying that everyone in healthcare needs to be a doctor? Absolutely not. But we're not talking about just anyone in healthcare. We're talking about the position that requires confirmation from the Senate and represents the absolute pinnacle of the medical establishment. Throughout American history, every single Surgeon General, with maybe one or two exceptions, has been a medical doctor with extensive clinical experience and public health credentials. These are people who have spent their entire careers understanding how the human body works at the cellular level, how disease manifests, how treatments work, and how to communicate this information to the American public. They've been tested in real clinical situations. They've trained under other experienced physicians. They know what they don't know. And here we are talking about someone whose primary background is in entrepreneurship and social media. But here's where it gets even more complicated, and this is where I really wanted to dig in with Casey when we sat down. Beyond the basic qualifications issue, there are some pretty problematic statements and positions that she's either promoted or associated with over the years. We're talking about claims that have been contradicted by mainstream science, some assertions that border on the fringe of the wellness movement, and a general approach to medicine that doesn't align with evidence-based practice. Now, I'm all for challenging conventional wisdom. I've built my entire career on looking at traditional dietary recommendations and saying, wait, is this actually backed by solid science? But there's a huge difference between challenging conventional wisdom with evidence and just making stuff up. One of the things I wanted to understand from Casey was where this all started for her. What made her decide to enter the healthcare space? What experiences shaped her views? Because here's the thing about humans, we all have a perspective based on our lived experience, and sometimes that can blind us to other realities. She's talked about her own health journey, her own metabolic issues, and how that led her down this path. That's compelling on a personal level, but personal experience doesn't qualify you to be the Surgeon General. Personal experience is actually one of the most dangerous things in medicine when it's elevated above actual scientific evidence. When we finally got her on camera, I wanted to start with the elephant in the room. I asked her directly about her medical qualifications and why she thought she was prepared for this role despite not being a physician. And I have to tell you, her answer was interesting. She didn't deny her lack of formal medical training. She actually leaned into this idea that that's a feature, not a bug. She said that she brings a fresh perspective, that maybe the traditional medical establishment is so caught up in pharma industry corruption and conventional thinking that they can't see the real solutions. She talked about metabolic health being the missing piece that traditional medicine ignores. Now, here's where I had to push back pretty hard, because this is a really common narrative in certain wellness circles, and it's not entirely false, but it's also not entirely true. Yes, there are problems with how conventional medicine approaches metabolic disease. Yes, there's influence from pharmaceutical companies in healthcare. Yes, we could do a better job focusing on prevention and lifestyle interventions. All of that is real, but the answer to those problems is not throwing out medical training and replacing it with wellness entrepreneurs. The answer is actually getting more doctors, more real doctors who understand metabolic health and who are empowered to focus on prevention. The answer is fixing the system from the inside, not blowing it up from the outside, with someone who doesn't have the fundamental knowledge base. I pressed her on some of the more controversial claims she's made or promoted. We talked about her statements on things like seed oils and ultra-processed foods, which, okay, we're actually pretty aligned on. The evidence is pretty clear that ultra-processed food is a major driver of metabolic disease and chronic illness. But then we got into some murkier territory. We talked about some of the more extreme positions on vaccination, on pharmaceutical interventions, on things that don't have the same level of scientific support. And this is where I really needed to understand what her actual philosophy was. What became clear to me during this conversation is that Casey Means operates from a fundamentally different worldview than traditional medicine. She sees the pharmaceutical industry as primarily a corrupt system that profits from disease rather than preventing it. Now, there's definitely truth to the idea that pharmaceutical companies have perverse incentives. That's a real problem that we should be discussing. But her view seems to extend to a belief that most pharmaceutical interventions are unnecessary, that most doctors are either complicit or duped, and that the answer is to get people focused on lifestyle and metabolic health above all else. And while I absolutely believe in the power of lifestyle and metabolic health, I also know that sometimes people need medications. Sometimes people need surgery. Sometimes modern medicine saves lives in ways that no amount of kale salad ever will. One of the things I really wanted her to address was her actual understanding of medical science. We talked about how you read studies, how you interpret data, how you understand the difference between correlation and causation, how you weigh evidence. Because here's something that's really important that a lot of people don't understand. Being interested in health is not the same as understanding medicine. Understanding medicine requires years of training in physiology, pathology, pharmacology, and clinical experience. It requires learning how to think about uncertainty and risk. It requires understanding the limitations of your own knowledge. And I'm not convinced that Casey has had that training or developed that way of thinking. We also got into the political side of this, which I normally try to avoid on this channel, but it's honestly unavoidable when we're talking about a government appointment. The fact that this nomination came from Donald Trump, who's made some interesting statements about medicine and public health over the years, adds another layer of concern. I asked Casey point blank whether she was prepared to give advice based on science if it contradicted what the president or the political base wanted to hear, and her answer was honestly kind of evasive, which frankly tells you what you need to know. Here's what keeps me up at night about this situation. The Surgeon General has enormous influence over how Americans think about their health. When the Surgeon General speaks, people listen. When the Surgeon General issues guidance, it gets implemented in schools and workplaces in public health campaigns across the entire country. The previous Surgeon General under Biden, Vivek Murthy, spent a lot of time on issues like gun violence as a public health crisis and social isolation. You can agree or disagree with those priorities, but at least he was coming from a place of medical expertise and understanding of public health. What would Casey Means do with that platform? During our conversation, she talked a lot about metabolic health being the root cause of most of our healthcare problems. And look, she's not entirely wrong. Metabolic dysfunction is a huge driver of chronic disease. But the idea that if we just got everyone eating whole foods and moving more, we'd solve healthcare, that's oversimplification to the point of being dangerous. What about the person with juvenile diabetes? What about the person with cystic fibrosis? What about cancer? What about genetic disorders? What about rare diseases? What about acute injuries and infections? These things require actual medical intervention. I also wanted to understand where her confidence comes from, because one of the things I've noticed about people who rise to prominence in the wellness space is that they often have this absolute certainty about things that the medical community is still working through. They don't seem to have the intellectual humility that comes from deep training in science. When you really study medicine, when you really study biology, you start to appreciate how much we don't know. You understand the limits of your knowledge. You realize how complex the human body is. And that tends to create a kind of epistemic humility that I'm not seeing in Casey Means' public statements. Now, I'm not here to completely destroy someone's credibility or to say that every single thing she's ever said is wrong. That's not fair, and it's not how I operate. She's clearly passionate about metabolic health. She clearly cares about trying to improve health care. Those things are good. But there's a massive difference between being passionate about health and being qualified to be the chief medical advisor to the President of the United States. It's the difference between loving to cook and being qualified to run a Michelin star restaurant. It's the difference between being interested in building houses and being a structural engineer. One thing Casey did say that I thought was interesting was her commitment to following the evidence. She said if appointed, she would commit to being guided by science and data. And I wanted to believe that. I really did. But here's my concern. If someone hasn't spent years training in how to interpret that evidence, how can they possibly follow it in a principled way? It's like saying someone who's never played chess but has read some chess books is going to make principled moves. You need the training to interpret the evidence correctly. We talked about what her priorities would be if she were appointed. And unsurprisingly, metabolic health, prevention through lifestyle, the role of the food system in driving disease, these were central to her vision. And again, I'm not against any of that. But a Surgeon General has a much broader mandate. They have to deal with infectious disease. They have to deal with mental health. They have to deal with healthcare access. They have to deal with healthcare disparities. They have to understand economics and policy and public health infrastructure. And I'm not sure that someone whose entire career has been focused on metabolic health and entrepreneurship is prepared for that. The other thing that really concerned me during this conversation was the certainty with which she spoke about complex issues. When you ask a real expert, someone who's trained deeply, they tend to say things like, the evidence suggests, or in most cases, or we're still learning about. They don't speak in absolutes because they understand that absolute certainty is rare in science. But Casey Means spoke with a lot of certainty about things that are actually quite contested in the medical community, and that's a warning sign. Let me talk about what I think the real issues are here. First, qualifications matter. If we're going to have a Surgeon General, that person should have medical training. Not only medical training, but deep medical training. They should be board certified. They should have clinical experience. They should have public health education. This is not a radical position. This is just saying that the person in charge of public health for our nation should actually know medicine. Second, expertise matters. A person's background in their field is indicative of their understanding of the field. Someone who's spent their career in entrepreneurship is not going to have the same deep understanding of medicine as someone who's spent their career in clinical practice and research. Third, humility matters. The best scientists and the best doctors are the ones who understand the limits of their knowledge. They're the ones who are willing to be wrong and to update their views based on new evidence. Now, I asked Casey about her critics and about the physicians who've spoken out against her nomination. And she basically characterized them as gatekeepers defending the status quo. She said that these doctors are invested in maintaining the current system because it benefits them. And look, there might be some truth to that for some people. But let's be real. The vast majority of physicians who are concerned about this nomination are concerned because they understand what it takes to practice medicine responsibly, and they don't think Casey Means has that foundation. Here's what I told her, and here's what I want to tell you. Metabolic health is critically important. I've spent my career studying this. The field of functional medicine and preventive medicine has a lot to offer, but that's separate from the question of whether someone is qualified to be Surgeon General. These are two different conversations. You can think that metabolic health needs more attention in American medicine and still think that the person leading our public health should have real medical credentials and training. These positions are not mutually exclusive. One of the things we discussed was how medicine is practiced now versus how it should be practiced. And Casey made some good points about how much of modern medicine is reactive rather than proactive. We treat disease rather than preventing it. We use expensive medications rather than addressing the root causes, and she's right about that to a significant degree. But the solution is not to get someone with no medical training in charge of public health. The solution is to train and empower physicians to practice in a more preventive, more evidence-based way. We also talked about what would actually happen if she were confirmed and became Surgeon General. What would change? And she talked about using the platform to educate Americans about metabolic health, about the dangers of ultra-processed foods, about the importance of movement and sleep and stress management, and honestly, that stuff is good. I would love for the Surgeon General to be talking about those things. But I'm worried about what else she might do. I'm worried about whether she might advocate against approved treatments. I'm worried about whether she might promote unproven interventions. I'm worried about whether she might undermine public health initiatives that are actually saving lives. The conversation kind of came to a head when I asked her directly, "Do you think you're the most qualified person for this job?" And she couldn't really answer that directly. She pivoted to talking about bringing diverse perspectives and challenging the status quo. But that's not an answer. That's a dodge. And it tells you something important. Look, I want to be fair here. This conversation with Casey Means was illuminating, and I appreciate that she was willing to sit down and talk about this. I think she believes what she's saying. I think she genuinely wants to help people. I think she genuinely believes that the medical system is broken and needs fixing. Where I disagree with her is that the solution is to put someone without medical training in the position of Surgeon General. Here's what I think should happen. I think Casey Means and people like her should have a voice in healthcare policy. I think the metabolic health community should have more influence. I think there should be more funding for research into the role of nutrition and lifestyle in preventing disease. I think the pharmaceutical industry needs more oversight and regulation. I think we need to do better at focusing on prevention. But all of that can happen without putting an unqualified person in one of the most important health positions in the country. If you watch this video and you still think Casey Means should be Surgeon General, I'm not here to tell you you're wrong. This is a political decision. It's ultimately up to the Senate whether they confirm her. But I'm asking you to think about it carefully. I'm asking you to consider what qualifications matter for this position. I'm asking you to think about the difference between respecting someone's passion for health and believing they're qualified to lead our public health system. And here's the thing that I keep coming back to. There are physicians out there who are deeply knowledgeable about metabolic health, who understand nutrition, who understand the food system, who understand how to prevent disease, and who also have medical training, who also have public health expertise, who also have the credentials and experience for this position. If we're going to have a Surgeon General who prioritizes metabolic health, why not get an actual doctor who specializes in metabolic health? Why do we have to compromise on qualifications? That's really the crux of this for me. And that's why I felt the need to dig deep into this conversation and to bring it to you, because your health is at stake here. The advice that the Surgeon General gives affects policy at the national level. It affects how your doctor treats you. It affects what your kids learn in school about nutrition and fitness. It affects public health campaigns and health recommendations. This is not a trivial position, and whoever holds it should be the absolute best person for the job, not just someone with a compelling personal story and a focus on one aspect of health. I hope this video gave you some insight into what's really going on here and what the stakes actually are. If you care about health and fitness, if you care about the future of medicine in America, if you care about the direction of public health policy, I'm asking you to pay attention to this. Do your own research. Look at what's being said about this nomination by actual physicians and public health experts. Think critically about what qualifications should matter for important positions. And most importantly, hold your elected representatives accountable for the decisions they make about who leads our health agencies. That's what this is really about. It's about ensuring that the people making decisions about our national health have the knowledge, the training, the expertise, and the humility to do that job well. And based on this conversation I had with Casey Means, I have serious concerns about whether that standard is being met. Thanks for watching, and I'll see you in the next one.